Good morning, teacher. Good morning, everyone. So today we will explain about case one, a man with dyspnea, type 1 hypersensitivity. And the next slide. So in history, in this case example, he is 20 years old, male. The symptoms as follows is Cindy, age of 12, paroxysmal dyspnea, and he last year had acute dyspnea, and 3 months ago he treatment combining a long-acting bronchodilator and a high-dose inhaled corticosteroid as well as a short-acting bronchodilator on demand, and now he have acute episodes of dyspnea several times a week, spontaneously or triggered by exposure to dust or cat fur. And now he presented to the doctor. He have a coughing, asthma, and tried. And the next slide. Okay. In physical examination, he have a pulse, blood pressure, temperature, oxygen saturation, respiratory rate, abdomen neurological is a normal, but cutaneous he have a dry skin without other abnormality. And the next slide by Kritia.
From the laboratory investigation, this slide shows the hematology. White blood cell, hemoglobin, hematocrit, white blood cell, and platelets are normal. Next table. This table shows the different count. Neutrophil, lymphocyte, and monocyte are normal, but eosinophil and basophil are higher than the reference result. So eosinophil and basophil are important effector cells in human allergic disease. Next. This slide shows clinical chemistry. Total protein, albumin, and CRP are normal. Next table. Serology tests are checked for present or level specific antibodies in the blood, including immunoglobulin G, A, and M are normal, and anti-neutrophil cytoplasmic antibody and Aspergillus fumigatus serology are negative, like a reference result, but immunoglobulin E and cat dander serology are higher than normal range. Next slide. The last test is pig test. Cat dander and how dust mite are positive, but reference results are negative. So we can infer that patient is allergic to cat fur and mice. Oh, sorry, that's next topic by Putipong.
So what does this call indicate? Let's look at the history first. He has been having a history of acute dust dyspnea, has both spontaneous and recurrent symptoms after exposure to dust and cat furs. And also he has the symptoms of coughing, asthma, and he also tired. And from the results, he has a high number of eosinophils and basophils, also high immunoglobulin E and cat dander serologies. In pig tests, both cat dander and house dust mite are tested to be positive. And this all can indicate to type 1 hypersensitivities. Next slide. So what is hypersensitivity disease? Hypersensitivity disease involves exaggerated immune response to normally harmless substance. This immune system, which usually protects the bodies, can mistakenly perceive certain substance as threat, triggering various reactions. This reaction can range from mild discomfort, like in allergies, to more severe conditions, such as autoimmune diseases. Next slide. So there are 4 main types of hypersensitivities. Type 1 to type 4 range from 1 hour to weeks. First one is mediated by IgEs for 1 hour, and examples are anaphylaxis. Type 2 are mediated by IgE or IgMs and takes hours to days, and examples are hemolytic anemia. The third type are mediated by immune complex, takes 1 to 3 weeks, and example are serum sickness or SLE. Type 4 are T-cell mediated, take days to weeks, and example are rash or SJS. Next slide. Now we look at type 1 hypersensitivities, or you can call it as immediate hypersensitivities. It's an exaggerated immune response characterized by the production of specific IgE antibodies upon initial exposure to allergens. Upon subsequent exposure, these antibodies trigger the release of inflammatory mediator such as histamine from mast cells and basophils, leading to symptoms like itching, swelling, hive, and potentially life-threatening anaphylaxis. Common allergy, asthma, and certain food allergy exemplify type 1 hypersensitivities, and the management involves avoiding the allergens using antihistamines, and in severe cases, having access to epinephrine for rapid intervention during acute reaction. Next slide. Now we look at the pathogenesis. Look at the picture. In the initial exposure to an antigen, you can see that the APCs or antigen-presenting cells capture and present allergen fragment to T helper cells, activating them to produce interleukin-4. And interleukin-4 prompt B cells to generate IgE antibodies specific to the allergens. Plasma cells derived from activated B cell release abundant IgE into bloodstream. These IgE antibodies attach to receptor on mast cell and basophils. Upon re-exposure to allergens, the allergen bind to the IgE antibodies already bound to the surface of mast cell and basophils. This cross-linking of IgE receptor trigger a cascade of intracellular events leading to degranulation. And during degranulation, these cell release perform mediators, with histamine being a prominent example. Histamine active mediators induce vasodilation, increase vascular permeability, and various physiological changes, culminating in the mediated inflammatory response and the manifestation of symptoms associated with type 1 hypersensitivities. Next slide, and we will look at the symptoms. Local symptoms in type 1 hypersensitivities involve skin allergies, exemplified by the development of urticaria or hive. When exposed to allergens, the immune response triggers the release of histamine, leading to rash and itchy red on the skin. Additionally, in the respiratory system, this hypersensitivity reaction can manifest as asthma. Bronchoconstriction and heightened mucus production occur in response to allergen exposure, resulting in symptoms like wheezing, churning of breath, and chest tightness, which are characteristic of asthma. In the systemic, we have two. First one is anaphylaxis, a serious systemic reaction marked by a sudden release of inflammatory mediator throughout the bodies. And the symptom can range from the skin manifestation like hive to respiratory distress, cardiovascular collapse, and potentially fatal outcome. And the laryngeal edema is the swelling of relax can occur, causing difficulty of breath and potential threat to the airways. And the next slide. Next slide, please. The laboratories will be explained by Pam.
Okay, in the laboratory testing, our example in the in vivo skin tests. So the skin prick test or SPT is a demonstrate a sensitization response to a specific allergens to confirm the presence of an allergy. And it is the demonstrate an immediate IgE mediated allergic reaction. So the skin prick test uses various allergens from animals, plants, food, pathogens, and environmental pollutants. And the next slide. The next slide is the intradermal skin test or will and fear reactions. It's used if their skin prick test was a negative and their provider still thinks that you're allergic to allergens. Inject in their dermis with a hypodermic needle. It is indicate for the diagnosis of both IgE and T lymphocytes mediated allergic conditions. And the next. The next is have two remedies. So the first one is a radio immunosorbentase, or RIST, is a measure total serum IgE levels. So as you can see in the picture, the first one is a solid phase anti-human IgE, and the second is a capture IgE in pertinent serums, and the third is a detects capture IgE with the radial labeled anti-IgE. And the next is a radial allogous survivance or RAST, is a major allergen-specific IgE activity. The first one is a disc coats with taste allergens, and the second is incubate with their taste serums, and the third is the radial labeled anti-human IgE. Okay, and their last slide. In the last slide is about the treatments. So I have two remedy too. The first one is antihistamines. It's to treat histamine-mediated conditions and block actions of histamine on vessel and smooth muscles. Is a reduce vascular permeability. And there's the second remedy is a bronchodilators. Is a beta agonist cause the smooth muscles surrounding the airways to relax by stimulating beta adrenal receptors in the airways. Okay. And this is our members. Okay, so we have done our presentation. Thank you for your attention.
Before we're gonna go, I have important information to tell you guys that don't forget to avoid your allergen or take your medicine as prescribed. And this one is very important. If you are athletes for anaphylaxis, keep your epinephrine auto injection with you at all times. Stay tuned. Get healthy. See ya.